Okay, so we're here today with one of our top doctors, Dr. Kossari. Dr. Kossari has been really great with our Welcome Baby program. My name is Mardee. I'm an outreach specialist for the Welcome Baby program, which has been around here in the San Fernando Valley for about a couple years now. We've been in Dr. Kossari's office for about the last 18 months, enrolling moms in the Welcome Baby program. The program's been very successful, and recently our relationship with Dr. Kossari has grown to the point of being able to really have a goal to enroll all of Welcome Baby moms through his office. Dr. Kossari, in my opinion, has taken a real advocate type of a role in his community, specifically in this community and this part of the San Fernando Valley, where he has I have seen a business model that really reflects his desire to improve the community. And with that, I asked Dr. Kossari to be a part of this video. And so I just want to get to know you a little bit better. Why don't you introduce yourself and tell us a little bit about how you have come to develop your practice here in this area.
Well, my name is Sean Kossari, and I thank you for the opportunity to speak about Welcome Baby, which I think is a great program. I've been in this field since 1999. I've trained at USC in undergrad medical school, and I've been in the community since then. And I love the community here, and I love the opportunity to be able to do what we do, which is very much in line with what your program is doing. In fact, I believe that what you're doing is very complementary to what we're trying to do, which is bring healthy babies into this world and educate the parents and the kids and give the best opportunity for the babies that are going to grow into young adults and eventually be running this country, basically. We welcome every opportunity to touch someone's life when they walk into our office. And I was very delighted to find out about what you're doing, as you know, which is instrumental in solving, in my opinion, a lot of the societal problems down the road. Because in 10, 20 years, we are going to see the difference, because majority of the issues that we see today, you can find its roots back in childhood, starting from the very first few months all the way through the first 5 years of life. And I think that's where First 5 LA comes into play.
Exactly.
The Welcome Baby.
So Dr. Kossari, you mentioned education. Education is one of the tenets of our program. We really try to focus with our Welcome Baby parent coaches, a lot of in-home support for education for moms and their families. How does Welcome Baby's education support your educational goals through your CPSP program in your office?
One of the biggest things that I think makes a difference in the health of the mother as well as the health of the unborn child is that education. As far as diet goes, activities, mental health, physical health. And we're fortunate enough to have a program, as you mentioned, called CPSP program. It's a California funded program that allows us prenatally interact with patients very closely and address whatever issue that they may have, whether it's domestic violence or obesity. The range is unlimited, so we can address everything that the patient may have, whether it be physical health or mental health, or any issues that they may have, even with the children. Some of the things that we find is that But when the mother is pregnant and there are siblings already in place, some of the education goes towards that. And no matter how much time we spend, it still has room for improvement. And when you came into the picture, the services you provide are absolutely complementary to what we're trying to do. So when you come in and you teach parenting, when you show them the roads and you show them cues as to what each cue that the baby has means, or if a sibling reacts a certain way when a new baby comes into the family, how do they have to react? As a parent myself, I had to refer to a lot of the material that's out there and available to learn what my older child mean by a certain reaction that they have with regard to the newborn that just came to the family, because it's a huge stressor. We don't know, they don't know, and if we don't understand each other's language, it would be detrimental in many ways if we react incorrectly. So when you come in and you actually sit down and explain that what those behaviors mean and what kind of reactions a new mother should have in situations like that, or you come in and you educate them about the very simple thing such as breastfeeding. What are the cues? That the baby's hungry or not hungry? Sometimes the parents come there frustrated because they feel incapable of taking care of their newborn because they don't know what it means that the baby's crying. What are some of the things that they have to watch out and some of the things that they have to address. So we try to address all of those things, but it's overwhelming with the number of patients that we have and all the issues that we have to address. So it's absolute pleasure to see that there is another organization that feels just as passionate about all of this, that is trying to make a difference.
Great, thank you. You mentioned breastfeeding. As one of our main initiatives of Welcome Baby is to support breastfeeding in mothers. As we all know, by 2020, all California hospitals have to be breastfeeding only or baby friendly. So with that in mind, how does Welcome Baby, having that in-home support for Welcome Baby breastfeeding, how does that breastfeeding support help your patients or reinforce what you're already trying to teach them through your programs?
You can finish what we start, basically, because we don't have that ability to go to the patient's home and extend that education that far out. Because I find that in the hospital, when the patient is in prenatal era time period, and they go into intrapartum, and then they go into the postpartum, I emphasize greatly how important breastfeeding is. I always educate them as much as I can. When they come back for their postpartum, oftentimes I find it that for erroneous reasons, some of the patients feel like they couldn't breastfeed. And I personally believe that is entirely lack of education about breastfeeding. Not enough effort, not enough support has gone into that process that has led to the mother not being able to breastfeed. They try it. I always say, it takes you 3 days. You have to try and try and try. Look at the methodology that goes into it, which starts in the hospital. But as soon as the patient goes home, they get overwhelmed with everything else. Now, if there's a supporting hand, like Welcome Baby, that goes to the patient's home and addresses or reinforces some of the things that we've been trying to reinforce, that's how you become successful. Then once you become successful with the breastfeeding, it has several upward spiral effects because the mother feels self-confident that she is able to take care of this baby. The baby feels that confidence and that connection because the baby has been in utero for 9 months, attached, hearing the heartbeat, feeling the warmth, being fed through the umbilical cord. And now you bring the baby out into a sterile world, disconnect completely, and then you put them in the crib and you stick a bottle into their mouth, they completely become disconnected. And that's, I think, where the benefit is, where you change the scenario, bring the baby close to the mother. That's why we do skin to skin once the baby's born. Just an hour, a golden hour we call it, just to have that connection, that warmth, because that baby, by being close to the mother, has the touch, feels the warmth, hears the heartbeat, and smells. All the senses, more or less, and sees the mom. All the senses are satisfied. And that connection, it's so instrumental. And if it continues, in my opinion, for the next few weeks, it already puts the whole process on the right path. And you, and what you do when you go to the patient's home, improves the probability of this whole process going in the right direction significantly. That's how I think you make that difference.
And I appreciate you saying that, because that's one of our focuses, is the bonding and attachment between mother and baby, which starts at the hospital level with our hospital liaisons and continues through the home visits with the visitation from the nurse, and also with our parent coaches. And you're right, just having that extension from office to hospital to home really creates an environment that the mother and the baby can really thrive. The other, one of the other things that I was thinking about while you're talking was just the overall confidence that the mom can have. Mothers often suffer from postpartum, even prenatal depression. I'm a mother myself. I had postpartum depression with my first 2 children, but not my last 2 children. And we don't always know why. What are your thoughts of how this program might be able to help support moms emotionally?
Obviously, a lot of the postpartum depression and the emotional roller coaster that the patient has to go through comes from, it's multifactorial. It comes from many different directions. It comes from the hormonal changes, environmental changes. It comes from the fact that they all of a sudden are introduced into a whole different world, and all of a sudden they are responsible for a new human being, and every breath that they take has an impact. It's overwhelming. It's surprising to me that we don't see more postpartum depressions. Imagine a new mom having all the support in the hospital, the baby is being taken care of whenever they cannot. They have all the questions answered, the doctor comes in and speaks to them and the nurses, and then they go home. They go home, the father has to go to work. If they have extended family that's available, more power to them, but what if they don't? And all of a sudden, they are faced with this unbelievable task of taking care of another human being whose language they don't even understand. So if this same person goes home and knows that someone is going to come around the corner and knock on the door and offer that support, not only an emotional support, but also a professional support, like someone who can really answer the question. Not like your next door neighbor who doesn't know anything about parenting, or whatever they know is not at the professional level. Someone who is an extension of your doctor's office, perhaps, comes in. It would feel like an angel sent from heaven for someone who is desperate for help, needs help. That's what Welcome Baby provides as far as the helping with the emotional support. And that, by far, I believe, is the most effective way to address postpartum depression. Because I think a lot of it comes from that emotional distress that could easily be whisked away by someone who knows what they're talking about, who know how to react to situations. And this allows the mother to all of a sudden perk up, become more confident, and better take care of the baby. Once they better take care of the baby, then they feel better about themselves, and the baby does better. As a result of it, that's the spiral upward, where you eventually are going to have a situation where developmentally you set the foundation correctly, and then everything falls into play. But that's not where you stop, right? You continue. You go into weekly visits, and then monthly visits, and eventually you go all the way to 9 months, right? So you go back and reinforce, redirect, and you teach more, educate more. For some people it may be a few visits, for some people it may be a few more visits. But you're there, and your only interest in the whole wide world is to make sure that that baby gets what he or she needs by providing the mother the education to be able, or empowering the mother to provide that care for the baby.
Exactly.
And at the end of the day, what you and I are going to have is a world for our children that is going to be that much better because of those children that you helped.
And I appreciate you saying that, and I really want to hone in on the confidence of the mother. One of the things moms are often worried about is this stage right for my child? Is my child going to be okay? Are they going to end up with something like autism, which is such a hot topic right now? What's going to happen? How do I know my baby's growing at the right levels, meeting certain goals? So Welcome Baby focuses on the growth and development of the child. How do you feel that helps your patients, that having that extra support in the home for those stages, since you're with mom and baby early on? What does that mean to you?
It helps us significantly, because if a professional is there and can look at the milestones, look at the developmental milestones that has to be there, and they recognize that, by just saying it, that developmentally the baby is growing the way the baby is supposed to be growing, it puts the mother's mind at ease, and that takes the stress away. So it helps the mother, and it helps us when they come back with their baby or with their questions. You can clearly see someone who has had support and someone who does not. Someone who comes in on a postpartum visit, they ask about normal rashes that the baby has. That sometimes their concerns are so out of bound because they don't know. Because you're a mother, you look at the rash and you say, "Oh my God, what's going on? Maybe this is all sorts of diseases goes through their heads." And if someone like your staff and yourself are there to explain to them that, this is what that means, and if the baby does this developmentally, it means a certain thing. So that education, it helps to alleviate some of the stress, and also teaches the mom that they're doing what they're supposed to be doing.
Well, Dr. Kossari, I really want to thank you so much for this interview.
Of course.
I really appreciate it.
My pleasure.
We appreciate the endorsement that you've had of Welcome Baby.
Of course.
And we just really wish you a lot of success as you continue to grow your business. So.